Okay, I'd like to welcome everybody today for this seminar, which is going to be brought to us by Aris Georgopoulos, who's going to be talking about healthcare procurement, and he's got some different angles he'll be bringing into this. And somehow AI and impact of SMEs, it sounds like research that would have received very good grant funding. I'm hoping, I'm thinking, and so very interested to hear about it and learn some lessons from it.
Thank you. Here we are. Do I need to be close to the microphone so for the sound to be captured, or it's fine? I can walk around.
You will be there. This message is to your website.
So yeah, excellent. So thank you very much for the kind invitation. It's really a great pleasure to visit the CCP again after the super successful annual event that you had not that long ago. It's really a great pleasure, great honor to be here with you and open the season of what hopefully would be a series of super interesting presentations. And hopefully we'll start with something which, at least it's in my mind, it's quite interesting, and it's an area that, for various reasons that we will explore in a moment, is an interesting area, irrespective of what hat one wears when engages with it. I have various hats. One is the hat of a lawyer academic. The other is a hat of a lawyer practitioner / consultant, but I'm also a user of healthcare services, and I'm a taxpayer as well, okay, as we all are. So in all these angles, in one way or another, are touched by the outcomes of healthcare procurement. It's competitive of not so competitive nature, as we will see, and the ongoing developments. And as I will explain, with the advent of AI solutions, there is this argument that new technologies could improve the outcomes for the system. So not just for the taxpayer, you get value for your money as a taxpayer in procurement, but also as a recipient of health services. Because if you spend more wisely on what sort of mundane procurement goods and services, let's say for the example of the NHS procures, then there is more budget to spend on training or retraining or hiring more of consultants or more doctors and so on. So what I will do today in the next 40 minutes or so, hopefully we'll have chance for Q&A and really looking forward for your questions and intervention, because this is very much an ongoing project, as I will explain. And it's a project, a collaborative project between myself, my unit, the research unit on innovation, procurement, artificial intelligence, strategic procurement of the law school of the University of Nottingham, with what was a startup, now a company in the tech area. As I will explain in a moment, Vamstar, they are experts in artificial intelligence, and they are a B2B platform, business-to-business platform with an expertise in healthcare procurement. So they facilitate this dialogue between buyers and potential providers of goods and services in healthcare, not just in the UK, but they have presence in the EU and other parts of the world, and it's emerging. So I will tell you a small story before we start. We look at the specifics. So during COVID, when we were all somehow isolated in our rooms, continue working. I remember giving classes to my then 380 students, first year students from my house at that time, which is a little bit counterintuitive intuitive. At least for me, it was time of reflection. Also, with regards to the ideas of what type of research, what topics to choose for. And in the interactions with some of my other hats, as I said, the consultants, I came, or my path with the path of my colleagues at Vamstar sort of came together, and we started discussing, because it was at the time, as you remember, where we were procuring PPE, supplies, or critical supplies for the front line. So very fundamental stuff, not rocket science. Simple things that you wouldn't pay much attention before COVID. And suddenly they were at the forefront of importance. And you all remember the shortages that occurred at the time, and the fact that the delivery of very critical care provision was dependent of the availability of a face mask that had certain specifications, not very sophisticated, but with certain specifications, right? And it was not there. The question was, should we go ahead with something which is suboptimal, but it's the best second solution that we have? All these questions, how quickly can we source all these things without having to rely on existing, well-tested, up until that point, global supply chains? What do you do with that? So we started a discussion about how the technology that they were developing could navigate the changing, already it was post-Brexit, so the discussion about changing the national regime of procurement had started. So the idea was to join forces, and they bring their tech skills and abilities, and with our sort of understanding of the law, and the projection of where the law and policy regulation and the issues that the new regime will be tackling, and the way that it would be dealing with those issues, to try to fine-tune their algorithm, right? To make, in other words, the algorithm that they use more responsive to the new emerging regulatory and policy framework. So this is how we started collaborating. And then a few years down the line, after very interesting and successful collaboration with them, last year we won this. We were awarded, we're super honored to be awarded with this innovation fellowship. Now, practically that means that my teaching commitments had been bought out for at least until the end of this academic year, to free the space for me to engage more actively with them and keep this conversation going, and then also follow the developments, as I will explain in a moment, in the regulatory and policy area. So this is the two, let's say, partners of the fellowship. Now, let me give you, I already started in a way to provide some background for today's presentation, but this is a presentation of, let's say, the phase of the project where we are at the moment. Let's contextualize a little bit the background. I think it's really important. First of all, as we all know, from the point of view of the impact of abrupt spikes in demand or shortages that affect global supply chains, we know we have felt the effects in different areas recently twice, right? Within the span of a couple of years. COVID-19 and Ukraine, in different areas, okay? But the lessons learned from what happens when the supply chain that they have been tested, built over a number of years, when suddenly there are bottlenecks or they collapse altogether, they are very live lessons, very relevant lessons. So what do you do when your supply chain that you have relied over a number of years, you have vetted all the participants, right, through all the compliance, human rights, green, net zero. What happens when that collapses? how quickly can you switch? And by switching now, I'm trying to use language that you will understand. You understand this language, but something that is very relevant from a competition perspective is how quickly new entrants can come in, right? Companies, especially SMEs, who are not, for whatever reason, had not participated in these supply chains. They participate in other supply chains that perhaps remain unaffected and could switch fairly quickly or as quickly as possible to fill the existing gap. Okay? These are, how do you facilitate that? The answer, I open a small parenthesis here, in the context of the PPE, you remember we had this fast track through WhatsApp, right? The VIP lane, and of course, there are a lot of issues about, from a various governance perspective, but from a practical perspective, that was one quick way available to deal with it. Of course, with a lot of, it was costly, because a lot of this interaction was carried out by middle persons, who of course they were charging quite a lot for making that call, for providing or forwarding the contact details of a telephone number. Yes, in Miami, for example. Yes, is it worth it? I mean, at the time, it was worth it because we had, our lives were on the line. Question: could that be optimized and have that discussion, right? Or increase the horizon scanning, the capabilities on both sides, both from the side of the buyer, but also from the side of the potential supplier, to find out and essentially reduce the asymmetry of information of the opportunity. If you do that, that means that from the point of view of the buyer, you can do away with all the extra costs for the middle people, or reduce them, not necessarily get rid of them, because of course, if the middle person through the WhatsApp fast lane is replaced by a system, there will be a charge for that system. But the charge probably will not be 75 million, whatever the high price tag we read in the news was. Okay? So some lessons learned from what happens when you have abrupt spikes in demand globally, okay, that affect supply chains. Then we have, of course, the ongoing, super fast-moving evolution, technological evolution with cutting-edge technologies. I'm using the term artificial intelligence as an umbrella term, not as an accurate description, because, of course, even if sometimes we have the discussion with my colleagues, that's their neck of the woods, and they say, look, we haven't had an agreed definition amongst all of us what it is and what it is not. But what we know is that there are emerging technologies that can facilitate this type of interaction and provide solutions that could help, for example, SMEs find out faster opportunities, or enable the buyers to identify potential new suppliers and go through the other process of getting in touch with them, finding out whether they can provide solutions, and as we'll see, increasingly the ability also to go through a vetting process before you allow them in your supply chain, especially if you are a central government purchasing entity. So you have machine learning. Yes.
So that, just to make sure, the supply chain is complex. Usually you have manufacturing, then you can have a distributor, you can have a retailer, you can have a buyer, It's in a simplified version of that, of course. Yeah. And I think the manufacturing one is more problematic than the other, to work with, because thinking about, the manufacturing takes place somewhere else, and then, it's the physical space, and the replacing that is much harder. And I don't know how much AI can help in that, for example. Here, in your talk, in your way of thinking, it doesn't really matter where it takes place. But in one way, you can even think of a model. You said AI will tell you to have a manufacturer that direct sales to buyers. Now I know who the buyers are. I don't need an intermediary.
Excellent. No, this is absolutely, especially, first of all, the discussion that we are having, the discussion, more importantly, the application of these solutions in procurement, it will very much depend on what market we're talking about. Is it the market of services, or is it a market of goods? How complex these goods are? And if we're talking about goods and we start by goods, right, the lessons learned is that you're absolutely right. The answer is that it is possible for greater transparency to exist, not to identify, as I said, supply lines that they were involved in that, because probably they were already under the radar one way or another, but potential supply lines that they are not involved in that particular market, but they could switch quickly. And what artificial intelligence can do, and there are already solutions that they are fine-tuned, is not only that, but also to be able, it depends what factors, how granular, at what level of granularity you go in your algorithm. Because there is, for example, the possibility of, I'm thinking now, the recent very unfortunate events in Greece. If your system says that, okay, I want to rely on quickly within the next month or so, find an alternative or see to identify a production line for something that I want to procure. And suddenly you see that there are various areas. Some areas, they are probably going to be hit by a cataclysmic sort of event. That can be tricky. It doesn't say that it will happen, but that will increase the risk factor. And then perhaps it will appear number 2 or number 3, depending on how many other solutions you have in the horizon scanning of the potential alternative sources. So they are small, and this is the other important element, is that what, from a technological perspective, what these systems and algorithms try to do is to combine information which a lot of it and data that they are publicly available, but they are not available in a form that can be deciphered quickly, and equally importantly, they do not speak with each other, right? And when they do speak with each other, or when you build these neural connections, then some emerging answers and new pieces of information emerge, and that is precisely the added value that, depending on the situation that we are, is cost-saving or life-saving. Yes, as we have seen in COVID. So fast technological evolution. Then at the same time, for different reasons, we are in the process, I'm thinking public procurement, but not only public procurement regulation. We're in the process of revisiting some of the fundamental premises on the basis of which our system were based. In the UK, the discussion began due to Brexit, yes, in the sense that, and if you remember, I still remember Dominic Cummings in a speech, I think it was 2014, long before the discussion about the referendum began, when he laid out his vision for conquering number 10, right? He said everything. But one of the areas that he said that will constitute the dividend, an example of a Brexit dividend, was that the fact that the UK or a UK outside the EU will not have to abide by the very stringent red tape imposed by the European public procurement rules, okay, the directives and their implementations in the UK. So after Brexit, there has been a process that we are getting closer to having the main instrument, the new public procurement law in place. But even when we have that in place, that will be the basic or the fundamental, the skeleton. There will be a lot of regulatory muscle, right, still to be negotiated and be enacted before we behold the new species of procurement. So there is an ongoing regulatory change, which of course, if you want to fine-tune your algorithms here, right? In terms of preferences, do's and don'ts. This is a moving target, so we have to keep pace of how things are progressing. And of course, the other interesting thing is that in the context of healthcare procurement, because healthcare is a devolved matter, right? It is possible for devolved governments to adopt slightly different approaches, right? For different needs. For example, because the Scottish economy or the economy in Northern Ireland or in Wales has or wants to support more actively within the provision of the law, SMEs, perhaps the way in which the public purchasing framework is drafted will try to introduce mechanisms to facilitate that, more perhaps than the rest of the England. Yes, so it's an ongoing debate to what extent this new regime will be identical, will be homogeneous across the UK. And of course, at the same time, there are other discussions about how do you integrate the net zero obligation to the procurement process, right? For central government or local governments. The regulation of AI and AI solutions when they are deployed for public services. And there is a debate, a national debate, international debate at different fora. The EU has, as I'm sure you're aware, a series of legislative instruments to regulate digital markets and of course establish some AI fundamental principles that will, if you want, inform and will enshrine the new system and the policies there. And to make things even more interesting, then there are trade issues regarding subsidies. I'm talking about the procurement and the possibility of, because if you look at global supply chain and you want to scan the horizon and then the algorithm says there is a fantastic solution, right? Third, fourth tier or 10th tier somewhere in China or in Japan. How would that solution, practical solution, will fit within the wider framework or limitation or potential limitations that may exist as a result of the new subsidies, screening or review mechanisms that are established or are applied in various jurisdictions. And of course, the digital platform regulation. And within, these are true for, I would say, all procurement systems. And on top of that, healthcare has its own particularities. And healthcare in the UK has, or the organization of the provision of healthcare has also some specificities that need to be taken into account when you look at providing solutions to work within this system. Okay, now, the problem, which is a problem that the solution developed by my partners and their colleagues or competitors, right, is to provide technical support or to provide technical solutions to improve the procurement process and ultimately achieve value for money and help improve the provision of healthcare. So what happens now is that you have here various possible supplies. This is the different pictures refer to different types of markets. So you have medicines, you have services, right? You have medical equipment, you have mundane goods and services, from toilet paper to very simple masks or gowns. That now, of course, it's one thing to produce them and buy them. There's another thing also to store them and dispose of them, right? Because all of these will feature as cost when we are entering in the full-fledged net zero environment. So something that you would say, okay, how much is it X per unit? It's okay, let's get more, we will stuff them somewhere. If we use them, fair enough, then we'll chuck them. That process now becomes costly. So you have to have a much if you want a long-term and what we call full life cycle approach on costing and the other elements. So this is why I said that every market has different challenges, but fundamentally the structure is the same. So you have this, I don't know if you can see them, interaction. You have purchases, could be hospitals, it could be a central purchasing body that buys goods from the market and then resells them or distributes them to other end users. Okay, and what's especially in the UK makes the system quite complex is that there isn't a clear structure. There are various attempts to centralize purchasing to achieve economies of scale by increasing demand, for example. And that doesn't happen at national level only. You have regional hubs that do that for the hospitals, depending on the. And the emerging picture of that is that, let's say you have a hub in the Northeast. I'm not mentioning specific examples or putting names, but I can tell you that this exists. And a hub central purchasing body for the healthcare or healthcare organization in the Southwest. And they have similar needs, and they want to buy something to a solution or a product to deal with a specific need. Sometimes they buy exactly the same product, exactly the same. The price difference sometimes can be quite significant. It can be significant to the extent that it cannot be explained. I mean, it can be explained from a competition perspective and barriers to entry, but it's not. It shows that there are some suboptimal or some failures within the design of the system. The same country, different region, buys exactly the same product with significantly different price, there's something wrong, right? There's something wrong with the design at the very least. And of course, as you know, when the plausible aim of aggregating demand in order to reduce unit costs, right? The price, I mean, that makes sense, absolutely. But what is if you want, or a possible negative externality? You rely, first of all, by definition, quite often you might limit competition because only bigger providers could cope with the volume that you're asking. Could you say, okay, but we're saving money? Absolutely. But that means that you start relying on creating an ecosystem, right, that relies on bigger players. An ecosystem that makes the entry into the system for smaller players and new entrants more difficult. Not only because of the lack of capacity. And then you say, okay, let's fine-tune a little bit, change the tack. So we keep the central aggregation ideal for price reduction, but we will break down, we'll create lots. So we will enable smaller player to provide a part, aggregated, but a smaller part. Yes, plausible, and it has been done. The first from our interviews and research, what we see is that this is true, that in theory could facilitate the participation of smaller companies into this ecosystem, but there are other legal hurdles that make it sometimes difficult. For example, I don't know if you've heard the term framework agreements in the context of public procurement. These are agreements where, let's say, buyers, when they do not have a very clear idea of the timing and volume of certain goods and services that they want to acquire, but they know that within a certain period of time, they will need certain kinds of services and goods from this genre, okay? And they could say, looking back, they say, in the last 10 years, we wanted X amount every 4 years or so. So these agreements, you could, under the old regime, set them up for a maximum of 4 years. And of course, the idea is and there was flexibility in the system. You could have single supplier agreement, or you could have framework agreements with more suppliers. So you choose who is in the agreement, who is in the framework at the beginning, And there, when you break it in lots, smaller entities can come in and procure. But then the question is, what happens once you are inside the framework? Yes? When the need arises. Based on anecdotal evidence that we have looked at, quite often, companies that for a number of years, smaller ones, that they are already in the framework agreements, find it difficult to compete for the so-called call-offs, these specific contracts that arise during the lifespan of the framework. Why? Because based on the previous regime, depending, and that was by and large the choice of the procurer, they could, they could award these individual call-offs directly without any internal competition, right? Or they could opt for some what we call mini competition. So something, a quick turnaround based on the initially agreed terms, and of course adapted by price, because price obviously changes over the span of 4 years depending on the market, more, yes, in some goods than others. But especially in healthcare, there seems to be, and this is part of the data that we want to collect, and the good thing is that with VAMSTAR, they have access to tons of data, because a lot of these are published, right? You can, and here is where the connection of what was asked, what was delivered, not necessarily the award decision, but what was delivered by whom, and then the spend. If you can combine all the pieces of information, then there is a picture that emerges, that you can identify who the beneficiaries, who, let's say, were the companies, or what type were the companies that had the majority of this type of contracts, even for simple stuff, right? And to make things even more interesting, now imagine that you are an incumbent, bigger player in healthcare, and suddenly the procurer says, you know what, we've heard that our counterparts pay for the same thing cheaper. Let's open up a bit the competition. Now, up until with the previous regime, there was the possibility of the existing supplier to challenge legally, right, the decision, whatever decision of the buyer. And in other words, engage in tactics that will really make it. It doesn't mean that they will win. No, they would not win, but it will take too long. And when you want to move ahead with your daily task, yes, you say, oh, is it really worth it? Or we go back, and inertia takes on. And when inertia takes on, suboptimal results ensue. Yes, I don't need to tell you this in this esteemed gathering. Okay. So first of all, the problem is that we don't have an integrated healthcare marketplace, and there is some fragmentation with regional markets. And by regional markets, I refer more to the market, not more as a geographical term, not the geographical dimension of the definition of what a market is, right? In terms from a legal or economic perspective. I mean about the market from the point of view of the demand side that is structured among devolved regional lines, sometimes even within, like England, you have clear regional arrangements, sometimes for practical reasons, but that's the reality of the matter. You have your beacons for healthcare provision and supply. And there is asymmetry of information. This is what we were saying before, sometimes, which of course has improved, has reduced over the years, but still exists. And COVID showed that, I think, very manifestly, right? That this happens. The other thing is that quite often, we had with Franco this discussion earlier on, sometimes the specifications that are of the goods and products that are asked are sorry, the goods are bought on product specification as opposed to outcome. And what sometimes you also have into the mix, and I'm not saying that that's wrong, but it is what it is. Let's say that you are a doctor, right? You work for many years, and you have used a particular syringe, something. That's the syringe that you practice as a junior doctor. That's the one that you use. Now, what if, and most probably it's the one that would be priced higher precisely because it has been used so much and it's the incumbent. Would you be willing to contemplate changing that? I'm talking about something very, very simple. When you put your ask into the system, the answer is probably no. And then you see that has a knock-on effect to strengthening that, what I called before, the systemic inertia. So specific suppliers, specific products, up until there's something really important to shake the system. It makes entry, especially for small, medium-sized new entrants, more difficult. They have greater hurdles to climb, not just regulatory, but sometimes in terms of end-user preference. So, and as I said, we saw in the supply chain collapse that the fact that we rely on existing supply chains that have been vetted, that means that there is less, or there is susceptibility to negative reactional shocks in cases of abrupt spikes in demand, as we have seen. And also based on, I think this is, as I will show you in the next slide, finding of report by McKinsey, I think it was, if I remember correctly, 2019, that you see a significant price differentials there. So automation, yes, could solve, and this is what this report had said. Now, I don't know if you can read, I will read it for you. So here you see different stages of the procurement process. I would add the support is much longer than that, because now it includes what we do with how do we dispose of the things that we've used. So it's very, very important, and increasingly equally even more important in terms of cost and responsibility. So source to contract, procure to invoice, right? And then the invoice to pay, very interesting. Sometimes you've heard stories about, okay, we won the contract, we delivered, where is the money coming, right? When are we gonna get paid by the public buyer? And then the support and follow-on support. These are, let's say, grosso modo, the 4 important stages of the procurement process. And you have under each one of them a column with different colors. So this one, the light one, is activities that they are not automatable at the moment using current technologies, right? The other, this color, is activities that could be, based on the existing technologies, technological solutions could be developed, but they are not there yet, so we need to invest R&D to develop these solutions. And then the darkest of all are those activities that they are automatable. And you can see how much scope there is. And as I said, this is, if you want, comes from the McKinsey report. That's already 4 years ago. Now, needless to say that in many of these areas, the lighter percentage has reduced because technology is moving really, really fast. So there is clearly a potential for application of these type of technologies at different areas. And of course, we are discussing with my partners. Of course, they are looking from their point of view. They focus on the stuff that they can increase their profit margins, right? Which makes sense. But of course, we're having this discussion. This is why the Innovation Fellowship is very, very useful. It gives the space for us to discuss also things that they would like to do when the opportunity comes, and be ready to move in and start contemplating the pros and cons.
Can I ask a question on the?
Yes, please.
Sorry, Alice. Yeah. You're assuming here that for this, if you want, artificial intelligence is available for the procurement side to create a better, if you want, service from the buyer. On the other hand, the same use could be from the big seller, that they can use the same AI and they can just, exploit that. And in principle, they can even avoid any small SME. Getting access to better data. Correct.
Absolutely, absolutely. So now let's look at some potential positive outcomes of more AI solutions into the health procurement and specifically to healthcare procurement for SMEs. And then the next slide is about the trade-offs or potential challenges, things that we would like to avoid. So yes, it could reduce cost of participating and monitoring. A lot of, especially in the follow-on support, can make the introduction of automation, right? Automation easier for SMEs. It can lower the overheads, and that means that if you have a specific pool, it means that you can release some of your resources to deploy in expansion. So more things and activities within the company to help it grow, right? So that could be a positive positive externality, if you want, for SMEs. The other things that I already mentioned is that there is the opportunity for them to acquire, but also for the buyer to benefit for a better insight as a result of the data combination, the neural network that could be created, to provide the opportunity to the SME to become known or proactively for them to engage with a buyer, to come themselves, to put themselves forward, or the buyer, to enable the buyer to spot them in a horizon scanning exercise like the one that I mentioned before. And also because now there is, as we have seen, increasing number of regulatory obligations of compliance, net zero, human rights compliance, modern slavery, anti-modern slavery compliance, vetting of these companies and their supply chain, because you could be an SME, right? And you could be in the middle somewhere and you have your own supply chain, right? And you have to ensure that your supply chain or your network also complies with all these elements. So the introduction of automation in this regard might also help them and reduce cost in this compliance, due diligence, let's say, points of view, and make it easier for them to engage with especially new markets in which they have not been involved before. But of course, as we've heard, every coin has two sides. And if a new technology is good for the small player, there is nothing to prevent the new technology being very good for the big player. Not only, you can imagine that it's the big player that can deploy the new technology faster, right? Acquire the personnel. And this is obviously this is irrespective of AI. The fact that there is a lot more regulatory compliance long list that anyone who is engaged in public procurement needs to go through means that sometimes SMEs are put off. I remember anecdotally a good friend of mine who has a very, very good company that qualifies as an SME in the higher end of the SME category. I asked him, Trevor, have you ever applied or participated in a competition abroad? I was thinking like cross-border, Belgium and the Netherlands. He looked at me and said, Aris, I've never participated in public procurement. So he supplies both private and public. I've never participated in procurement beyond Lincolnshire and Nottinghamshire. Right? So that gives you a flavor of what red tape or the perception of red tape puts on the decision to engage with an opportunity, even if you know about the opportunity. So there are various hurdles. Finding out about the opportunity, once you find out, you say, yes, but I have to go through all this process. That helps, of course, that is helped by the new technology, but the bigger players are always in a better position to take the get-go decision and be there faster. As we said before, is the skill gap. Because yes, there is technology, but it's not an automatic. You have to have some in-house to rely on in-house skills or outsource that skill provision, which means extra cost perhaps. And that's where, from the point of view of the companies and P2Ps like Vamsta, try to provide something which is competitive, right, for them, for smaller players to engage, even if themselves do not have the skills to engage and tackle the new environment. And here is I think it's a more philosophical question. Is a thread that informs my engagement with this project. Is it only about data and data combination? Because, as I said before, that will lift the veil of the opportunity. But then there is something still, which is very much old school law, right? Great news for lawyers because they are there to provide the service. But from the point of view of reaching better solutions faster with less cost, that will remain, right? That will remain because there is a procurement officer, as we said with some colleagues. Nowadays, in the old days, their procurement, the role was procure whatever they are asked to procure. Now they have to be competition lawyers, right? They have to look, what would my procurement decision, what could be the impact of my procurement decision on the market? Yes? Because simply getting much better price, that's not enough. It's enough from the procurement perspective, but as you remember, right? NHS procurement, water matters effects. We don't like that, CMA, yes? So you have to be well versed with this environment. Nowadays, increasingly, you have to be able to comply with environmental sustainability, wider sustainability goals and practices. And that is not just for the buyer, but also for the company that wants to be ready to say, we are here and we tick every single box. So it's not about lacking the information or the data, it's about having the ability to tick all the boxes. And this is something which remains as a challenge. So the next steps, and I will conclude. So we have already carried out some interviews with specific key players at different levels, so both suppliers and demand side. What we are finalizing, and we will soon share, is questionnaires sent to practitioners, suppliers, buyers in the healthcare sector, in order to ascertain, to find out blind spots, things that the existing regime makes their life more difficult, and that could include the legal regime, right, and compliance. And then the next stage is, once we have a first idea, then we'll have separate, obviously, workshops with buyers, and we'll try to have this discussion, to reflect the different, the default arrangements in this regard. So I'm in the process of contacting and finding places to meet up in Edinburgh and in Belfast. Yes, very interesting. And so, as I said, the idea is to identify the blind spot and, of course, adapt the analysis or the findings to the ongoing changing environment, regulatory environment, because, as I said, we are almost there with the Procurement Act, with a new act in Parliament, but that is just a skeleton. Then healthcare will have its own flesh to put on that skeleton. And even the regime that we are discussing from the point of view of the commissioning is a whole different matter, right? And lack of competition or the degree of competition that is envisaged or desired by the legislature is another element. So And then last but not least, share the insights. Yes, share the insight. Keep the discussion going, because this, of course, is something, as the technology evolves, the ethical standard discussion. I sent a few links just to keep the discussion, to start the discussion about the wider issues about the ethical, the regulation of AI and the parameters that I think in the discussion we need to have, and at what level we need to have the discussion. If you go to my website, there are more blog spots, more generic, because I sent you, I think, the one only on health about AI regulation and the developments in the EU and beyond. And last but not least, I would like to ask for your ideas, comment, not just today, but as you go along. Please do share them, because this is a discussion that I very much would like to keep open, not just with the stakeholders of that market, but with other colleagues and disciplines, to increase the approach and the angles, perhaps to avoid missing things that our angle might miss. So thank you very much for your patience. These are my contact details. I assume that later it would be shared, and that's Aris of Loxley. Loxley as Loxley is my website. Okay, thank you very much.
Thank you very much. All right, we have about 10 minutes that are left for discussion. So anyone with comments? Martin?
So I guess one of the consequences of this getting ever more complex is that once a company actually is awarded a contract, having won it, they've got a big tick, because everybody knows that they apparently met those criteria.
Mm-hmm.
That tick is particularly impressive if it is, if you like, awarded by an entity that is big enough to take this whole thing very seriously. Yeah, so if it's faking them, then probably they haven't done a big job anyway, so who cares? But if it's the central government that does it, that's different. And now that has, I think, two consequences potentially. One is that the bigger procurers are going to get a better deal, because awarding the contract do not only give the company that wins it the job, but it gives them a massive tick in any other procurement they do. So there are big effects.
The experience, we've
Yes.
done it before.
So there's massive externality there. And that gives them an advantage. But it also means that it gives an advantage to the big procurer, because they're going to get a better deal. The ones who can't afford to do it and just go by, oh, well, you know, Nottingham did it, so we can do it, because they're probably safe. So it skews the sort of prices that are paid by different procurers simply because of that signaling effect. But it also makes it very difficult for anybody outside to come in. And then on top of that, you may get something which we've seen a lot in procurement, of course, as you well know, and that local teams always win, because the local procurer has an incentive to make sure that it's the local firm that sends the positive signal. So you don't let the foreign guys win.
Yeah. All the observations, I think they're spot on. With regard to the first one about the aggregation, the fact that it's a huge box ticking, you're absolutely right. The legislation legislation that follow a similar approach imposed, and that's stemmed from the directive, the European directive, and the implementation at national level, is that there is, precisely in order to avoid that, there is a requirement for a buyer to consider, or the default position to be, to break down in smaller lots something that is aggregated, which is a completely different signal, an obligation that was imposed. If you look at the directives when they were the ones with teeth in the 90s, they said aggregation. If you can aggregate, you are obliged to aggregate, right? You are obliged to aggregate. Now, the signal is opposite. If you can break down, but not in order to avoid competition, in order to increase competition, right? You should do it. And if you decide not to break down in lots, and if you decide not to, you have to explain why you decide to aggregate. It's not, from a legal perspective, and it has not been applied as yet very stringently, in the sense that somebody, a procurer or a public buyer that wants to aggregate, they can continue doing that, or they could go through another pathway, which is also frequently used in practice, framework agreements, because that's already the aggregation, not on a specific contract, but in the context that you say, in over these 4 years, we know that we will need a volume X. We don't know when. When we find out, when the need arises, we'll come back to you. And then within that, they could have aggregation decisions as opposed to, which is more difficult to monitor. And this is where the new regime hopefully will shed some more light. So my hope of this post-Brexit regime would be a little bit more light in the frameworks, something that was not impossible under the European regime, because it's about how you fine-tune the system. Yes, how you fine-tune the system. So that's the part. That's one of the parts that I'm waiting more eagerly to see how more light would be shed in that area. So you're absolutely right. The system tries to create opportunities, but that doesn't mean that when you have your budget and you know that if you aggregate, you will get a cost saving. Would you think what would be the impact of my decision on the market, or what would be the impact of my decision on my budget?
It's very interesting, isn't it? Because the local authorities have a duty to be market makers when they buy social services, buy care homes, etc. So, and I don't really know what the hell that means. I've talked to them about what do you mean by
there
that.
is the obligation of socially responsible procurement, which all central government bodies. I didn't go into that detail since January 2021. And now that's the organizations that are captured by that obligation has widened. That 10% of the award criteria, of the weight of the award criteria, has to be on social responsible procurement, and that could be where you source. Doesn't mean that you give extra points if the company is here, but you could frame in very innovative ways your procurement in a way that leads to the same results. I don't want to go much more, but there are ways around that, and we see that, especially in devolved areas, in devolved procurement, there is that element. It's an opportunity for them to support their local economy, and they are using it. Fair enough.
Okay, I think there's one thing you said I was curious about. You were suggesting that procurement officers really care about getting a low price. And I'm just not so sure that's true. They care about satisfying the terms of their procurement, and that's about all they care about.
Absolutely.
And they want to make sure they follow the 500 pages of rules, or however many pages of rules they have that are there. It's their guidebook. And what they don't care about is getting the best deal for their buyer very often, right? They don't, it's not part of their objective function. And if you talk to many of them, my experience is a lot of them don't realize that the core job of procurement is to make competition work. They don't even think that way. They think it's about the 500 pages and applying those.
Compliance, focus on compliance. You're right on that. And let me clarify what I meant by price. So price is not the only criterion, and rightly so. You have all sorts of other performance criteria, and an increasing number of them, social, environmental, and so on and so forth. But there is price as well. And that's the impact on your budget. So when you go through that process and you're focused on compliance, you reach a point where you ask yourself, can I squeeze the price? Everything else, we are hunky-dory. That's it. We like it. Can we push for them to? The logical thing would be, from the procurement and budget saving perspective, would be to go for the lowest price and use it and say, look, how much I saved you guys, right? If you know that you can do that, you will go for it. You won't necessarily, in the old days, you wouldn't think, but what would be the impact on competition on private provision of hospitals? Would that make the magnetic resonance equipment more expensive for them, right? If you have the muscle as a buyer, as a dominant buyer, and that is the point that you can understand, you can make the difference, you will flex your muscle, right? Now, on top of that, they will have to bear in mind potential negative externalities on the market. This is what I said, and perhaps they have not incorporated that, but this is what they are expected in their job description. And they have to be very well versed with sustainability and life cycle costing and net zero, so on and so forth, for the salary that they're getting paid. Yes? So you know all that, perhaps you can do something much more lucrative.
Okay,
Yeah.
thank you very much. We're going to close out the official part of the session now. So anyone who needs to leave on the hour, please feel free to do so. But keep the recording going until we're done with the conversation. And so we'll just continue the conversation.
Fantastic.
For a few minutes.
Great. Wonderful.
So are there any questions online by any chance?
No, many thank yous.
Okay. Yes, Neil.
If you're training like an AI procurement system based off of historical data, how concerned are you about sort of that data then sort of perpetuating
Bias.
Yeah.
In the system. Absolutely. That's one of the top risks. It's a risk that one hopes might be mitigated by this merging of data, diverse data, right? Because if you're, and this has been the case of big data so far, is you look at contracts award notices, and if you have the same company appear, then if that your system is based on that data source, by definition, there will be a significant amount of bias in favor of a company, right, that appears again and again because they are the best. That's how the system perhaps will interpret it. But if you start combining, if what you're looking, and depends of how you fine-tune the parameters and how the level of granularity of the elements that you want to extract for the different and diverse data sets. To give you an example, prospectuses, right? Things that they are publicly available, not in one database, but they are out there. Can you find interesting information about, for example, the potential of a company that is not currently delivering or is active in a particular, so it does not appear in the dataset X, but there are some prospectuses that show that this company in another jurisdiction, somewhere else, provides that. Yes? If that can create some neural connection, some new piece of information that could enlighten a buyer that said, you know what, these are the new guys, or could become part of the existing supply chain in the public sector because they are in the existing supply chain of the other company who is in the public sector, but they are collaborating on the private sector for whatever reason. You don't know. Yes.
That raises an interesting question about, because what you really want to do there is invite companies to come in who haven't really thought about it. So you look at them, more extreme, they've never done this ever. But they actually happen to have, you look at the people they've employed, they have in the company, they could do this really easily if they just hadn't thought about it. In terms of fairness, in terms of level playing, can you then go and say, guys, would you like to bid for this? Because here's what we think you can do. Are you allowed to do that? The other thought I just had is just remembering, thinking about our local cinema here. You don't have to procure on price. You can do something much more clever that messes with the bidders, which is you procure on quantity. How much can you produce for us if we give you £10? So they did that with cinema screens, the art house theatre. And it was an insane success. They got so much more than they thought for their money. And with some of these products, of course, the problem, as you pointed out earlier, is, where are you going to store the half-ton of toilet rolls that you now have? Yeah. So you need, but if you also think about quantities, if you were the company that is providing it, you're doing something big. It sounds good, right? Whereas, so you have much more kind of, you don't have the same interest, but you have much closer aligned interests.
For the first part is how, when you get the information or what that information reaches you, how can you act upon it, right? Can you tell them, come here? This is precisely where the regulatory constraints in public procurement arise, because in private, that's precisely what would you do, right? In public, there are certain constraints about transparency, level playing field. The new regime, or at least that was the idea, was to make things a little bit more flexible. And once this, the procurement of, the reform discussion, or the discussion about the legislative reform of the UK regime had taken place, even in the context of the EU, based on the 2014 directives, there is an acknowledgement that what we in the procurement world call the pre-commercial procurement availability, or the possibility of engaging with the market at a stage before you start the procurement, just to do that more meaningful horizon scanning, not in order to avoid competition, but in order to increase competition. Yes? So there are methods, more often than not, you see that in procurements where innovation or innovation procurement, which is another important area that I'm interested in, that's where pre-commercial procurement is fundamental, because you need to identify different stakeholders that perhaps have never engaged in this type of work with the public sector or that side of the public sector, and you have to create an environment that is transparent, is fair, but also is fairly flexible in order to enable the creation of the discussion in order to reach some solutions. And there are stages, but that's for innovation procurement. For something mundane and very simple, I think the impression that I get is that they want to facilitate that more than previously, which I don't know whether it is a change in the law. It could be a change in the attitude, because you might change the law, but if the attitude remains the same, it means that you have flexibility, but you might decide not to exercise it. Yes, because you focus on compliance, real compliance. So all these questions will be answered in the medium term, once we have the new beast in front of us. We'll see.
Can I ask a non-technical question about whether you'd like some tea?
Yes, please.
Okay. With milk?
Of course.
Okay, so we'll conclude now the
Thank you.
the open part of the session, and we're going to move on to the filling our stomachs. So, thank you.